Yes, you are looking into the picture of the motorway, a very smooth and broad way for the passage of smooth and very fast running vehicles. So, can we compare it with that of your dorsal column, right? Which are known as posterior white column of the spinal cord. What they are meant for? If you concentrate, they are meant to conduct the discriminative touch, you fine touch, the vibratory sense, and other important sensations like joint sense, and the 2-point discriminative touch is there. Now in this picture we can see the cut section of spinal cord, and you can observe the dorsal white column. Here what you see, medially located the fasciculus gracilis on both sides, and laterally located the fasciculus cuneitus on both sides. Now let me tell you that what they are meant for. The fasciculus gracilis, you find it throughout all the segment of the spinal cord, right? And okay, few facts about the fasciculus gracilis and Cuneitus. Okay, first the fasciculus gracilis as being present on both sides of the posterior septum, medially located. These fasciculus gracilis, they are supposed to carry information from your lower limb and the lower trunk, and this fasciculus gracilis is present throughout all the segments of the spinal cord. Okay, and what spinal nerves are giving information to it are the sacral nerves, lumbar nerves, and the lower 6 thoracic nerves, right? And now let me clear the concept of the information regarding the fasciculus cuneitus. Being present laterally on both sides, they take information from your upper limb and the upper part of the body, and which nerves contribute to it. They could be the upper 6 thoracic nerves and all the cervical nerves, right? And definitely taking info, again repeating, from your upper limb and the upper trunk, right? And there lies an easy mnemonic that how we remember that which fascicle is gonna receive which information. So concentrate, the fasciculus gracilis, G is equal to G, means G for gracilis and G for ground or floor. So your gracilis is taking information from your foot, floor, ground. You can associate these things. And as the cuneitus is located laterally, so we have got our both upper limbs located laterally in comparison to your lower limb. So easy to remember that these fasciculus cuneitus on both sides are dealing with your upper limb being located laterally, and the fasciculus gracilis being located medially, and they are supposed to take information from your lower limb predominantly. Thank you. In this picture, we are supposed to learn that there are so many receptors, either exterior receptors or anterior receptors. They are supposed to get sensory information, and via primary afferent neurons, they are supposed to be taken towards the dorsal root ganglion having the neurons, and their central process moving towards the dorsal white column, and they are making the fasciculus gracilis and fasciculus cuneitus, and then they ascend upwards towards medulla oblongata, and they reach towards the two nuclei situated respectively. The medial one is the nucleus gracilis on both sides, and then the laterally located the nucleus cuneitus, right, on both sides again. Now let me show you that what happens next. Let me clear these lines so that I can make you clear once again. Now the game is there that nucleus gracilis and nucleus cuneitus, they have received first order neuron, and from here the fibers originate, called as internal arcuate fibers. They run anteriorly and medially and cross towards the opposite side to form the medial lemniscus, and they ascend upward in the medulla oblongata, and then into the pons and the midbrain, and they have to reach towards the thalamus in its particular nucleus, which is ventral posterolateral nucleus of the thalamus, and from here they should reach towards the cerebral cortex, the sensory cortex, right? Now in this picture you can very well see that there lies the skin, the epidermis and the dermis. Now let me show you the presence of various receptors, the Pacinian corpuses, meant for the touch. Very fine touch is there, right? Now in the picture let me show you that they have got the Merkel's discs. They are located where? If you can observe, they are near to the stratum basale of this epidermal layer. They are supposed to also get information related to the touch, right? Merkel's discs, you can observe here, as I told you, are meant to receive the fine touch and very light pressure, right? Now in the picture you can observe that there lies the Pacinian corpuses. They are just like a lamellated discs, and what they do, they are supposed to receive the sensation of pressure, right? And what else I want to show you, let me show that there lies the another location of the hair root plexus, and that is meant to receive the stretch type of sensations towards your body, like so. You can also find the end bulb of Krause, again meant to detect the touch sensations, and of course there are so many free nerve endings you can see for the temperature sensations in the form of heat and cold and pain, of course, right? And after that, let me tell you another one. After the deeper Pacinian corpuscle, you can observe the Ruffini nerve endings. They are meant to receive the pressure sensations, or rather deep pressure, right? And then you can observe there is another variety which I mentioned, Ruffini nerve endings. They can detect the vibration sense as well, and a little bit through that the hair root plexus they can also observe the vibratory sense. And of course, in addition to all these, if you have got another picture to show you the muscle spindle, from where we can get the interoceptor sensations like that of the joint and tendon proprioceptive information, right? Okay, in this picture we can see that how the spinal nerve or afferent fibers are taking various sensory information like stereognosis. You know what it is, that we can appreciate the size, shape of a structure by holding in our hand. And from here, another sensation, the 2-point discriminative, the fine touch, they all are reaching towards your spinal nerve and the dorsal root ganglion again. And you can observe the Fasciculus, Cuneitus and Gracilis, and in their form they are running along with this, carrying inside the first order neuron, and they have to reach towards the nuclei of the nucleus Cuneitus laterally, and medially located the nucleus Gracilis. Of course, fibers as in internal arcuate fibers, they anteriorly and medially move and cross, so form the great sensory decussation, and then ascends by forming the second order neuron, the medial lemniscus, and they have to run upwards via passing through the thalamus and finally reaching the sensory cortex of your this whole system called as posterior column medial lemniscus, right?